People use birth control because they want to have sex. Sex is great, but there are two important things to consider that can sometimes come along for the ride. Sex can cause pregnancy, and sex can cause you to catch a disease. As with any relationship, when you have sex, there are two people involved. Both people need to know how to protect themselves from pregnancy and disease. In sex, just as in a relationship, sometimes both people have penises or both people have vaginas, and sometimes one person has a penis and one person has a vagina. The birth control you use will depend on whether or not you have a penis or vagina, but both partners are responsible for protecting each other by using birth control. So if you have a penis and are planning to have sex, what sorts of birth control are available for you to use? Well, the first is the withdrawal method. This means pulling the penis out from the vagina, anus, or mouth before you ejaculate. We really don't recommend this method if you really want assured protection from pregnancy and disease. The second is a condom. Condoms are one of the most commonly used forms of birth control. They cover the penis and prevent any of the ejaculated fluid and sperm from entering the vagina, anus, or mouth. You can buy them in most grocery stores and pharmacies, and you have to use them every single time you have sex for the protection to work each time. Like any method of birth control, there is a chance that a condom wouldn't work or could break, especially if you don't use it exactly the way it says on the package. And you know what happens then: babies and disease. But in general, using a condom will keep you much, much safer than if you didn't use birth control at all. And don't make your partner have to ask you to put on a condom, just do it. The third is a vasectomy. It's possible that you haven't heard of vasectomies before. It's a procedure that's more likely to be done on an older man who doesn't want to have any more children. A doctor performs a very easy little surgery so that no more sperm can come out when the man ejaculates. This procedure is generally simple and safe and only has to be done one time, but you should wait until you think you don't want to have any more children until you have a vasectomy. Vasectomies are good at preventing pregnancy, but not good at preventing disease. If you have a vasectomy, you or your partner can still get sick by having unprotected sex, so keep using other forms of birth control like condoms. The fourth is spermicide. Spermicide is a chemical that can be found in lubricants or on condoms. This chemical causes sperm to die so that if they enter the vagina, they can't cause pregnancy. Some condoms have spermicide on them, but you'll have to make sure that's on the package and that it's really there. If it isn't, you probably want to put some on yourself or make sure that it's in the lubricant you're using. Many methods of birth control are better than just one, so it's great to use spermicide with a condom. You can find spermicide products at the grocery store and pharmacy where you would get condoms. So how do you protect yourself and your partner if you have a vagina? There are many different methods of birth control that you can use too. The first is timing. You may have heard that some people avoid getting pregnant by keeping track of their menstrual cycle. There are only certain times during a month that a woman could theoretically get pregnant because one of her eggs is available. People try to avoid getting pregnant by not having sex during this time, but it turns out it's pretty hard to predict when the egg is going to be around, and people can end up pregnant when they don't want to be using this method. We don't recommend using this method alone to prevent pregnancy. The second method is the diaphragm. This is very similar to the idea of a condom, but it's for someone with a vagina. It goes into the vagina and covers the uterus so that sperm can't enter the vagina and find the egg. It's good to use so that you can prevent pregnancy, but you can still get diseases if you're using a diaphragm. So people often use condoms and spermicides and other birth control methods too. You can get them from your doctor or from a grocery store or pharmacy, and they should be used every time you have sex so that you're protected every time. And the third method, and a very popular one you've probably heard of, is hormonal birth control. So another way to prevent pregnancy is to prevent the person with the vagina from ever having an egg available for the sperm to fertilize. Hormones prevent the egg from being available, and the woman takes hormones for this purpose in many different ways. You'll need to go to a doctor to get these forms of birth control. And these forms of birth control can also prevent you from having your period. There are many different types. The pill, you've probably heard of. It's a hormone pill that you take every day. There's also injections of hormones that you can get monthly. The NuvaRing, which is a ring that releases hormones into the vagina that you replace monthly as well. And the birth control patch, which releases hormones through the skin and is replaced weekly. This variety is great because it allows you and your doctor to choose the method of birth control that will be best for you and your life. Remember, all of these methods of birth control prevent pregnancy, but not disease, so when you're using hormonal birth control, keep up with your other methods as well. And the fourth and final method is the intrauterine device. This is a T-shaped device that your doctor can put in your uterus that also prevents pregnancy. It can stay in the uterus anywhere from 5 to 10 years, and once it is in, you don't have to think about it too much. Again, there's no protection from disease with this device, just pregnancy. This might seem like a lot of different things to think about, but it's just part of having sex and being safe. Just talk about it with your partner, because safe sex is by far more fun. And remember, your doctor can always test you for diseases and discuss methods of birth control. You should get tested if you think you might have a disease that you got through sex. You don't want to make the people that you love sick, and your doctor can help you get treatment for your infection. They really just want you to be healthy, and they know a lot about how the body works and pregnancy and disease. So if you're ever sick or hurt, you can always talk to your awesome doctor.